Hey there, I wanted to come on today and talk to you about no one is going to care about your health as much as you do, more than likely, and just how important it is to be your own advocate. I hear stories every day from friends, from family. I've had personal experiences from clients that they're just not getting the care that they need, or they're feeling misunderstood or not listened to. And it does happen. And I want to apologize on behalf of the healthcare industry, because I do believe that providers, almost every provider who you visited over the years, got into healthcare because they wanted to make a difference, because they care about people. And unfortunately, we have a system that is ready for some upgrades, as I think many of us are here seeing and noticing and have had our own personal experiences with. And here's the thing, the human body is complex, and so is the healthcare system. And it does require looking and taking care of your health with that systemic approach. Nothing happens in the body in isolation. And while it is a whole degree to become a healthcare professional, there's things that you can do as an individual to advocate for yourself. And one of the biggest things is to stay curious, ask questions, and if you're not getting the answers that you feel are supportive, to continue to ask questions and to stand up for yourself. And I get it, especially if you don't feel well, this can be exhausting. So having somebody in your corner to support you on this journey is going to be really helpful as well. But it does require asking your provider, why are you ordering that? What is that about? Is there a lifestyle approach that can help me with this? Here's the thing, the system's great for trauma. So if you break your leg, you have a heart attack, if your gallbladder is about to rupture, any of those kinds of things, yes, we've got it covered. Modern day healthcare is so great for that. And I love that, right? We are still learning how to navigate chronic disease. We have protocols, we have ways that we can manage heart failure, manage hypertension. And I think as a people now, we're waking up to, can I heal this? And there are many chronic diseases that we're finding now have ways to, at the very least, reverse and put into a remission, so to speak. So asking those questions to your provider, making sure your provider believes that you can get well, believes in supporting you the way that you want to carry out your healthcare journey. So it's important, ask questions, write them down before you go to the office. Here's the thing, most providers are scheduled back to back to back to back to back. It's the way the system is operating these days. A lot of it's ran by upper level people that the providers don't really have a whole lot of say so. This is their job, and this is like the system that they're in, right? Unless they go and work independently. It's dictated by people outside of your doctor or your nurse practitioner or your PA. So write down the questions that you have and then write down the answers to them as well. What I asked, I'll give you a prime example. I have some thyroid nodules, and on the report, it said, go ahead, recommended to do an FNA, fine needle biopsy, fine needle aspiration. And I don't really want to do that. If I need to do it, I will do it, right? So I asked the doctor, look, doc, what would you do if this was you? Like, I'm looking at the report, doesn't look good. I'm not opposed to doing it, but like, if it was you, what would you do? I'm not having any thyroid symptoms. I'm not having any swallowing complaints. I've had these nodules for a long time, and the doctor said, honestly, if it was me, I would watch it, and we'll monitor it. We'll check it in 3 months. If something changes, contact us immediately. Here's the reason why. And he gave me a whole update on thyroid nodules, on the accuracy of the ultrasound, how false positives come about. I'm not giving medical advice here. I'm not telling you not to get any biopsy. That is not what this is about. What this is about is sharing with you the power of advocating for yourself, of asking those powerful questions. And if you don't understand, because look, I'm in healthcare, I understand it. You very well may not be in healthcare, and it's okay that you don't understand it. When I go to my finance person, I'm pretty sure every quarter, every conversation, I'm asking them questions that they have already answered. Unfortunately, I invest my money with somebody that I trust and who is very patient and is very caring and tells me the same things probably every quarter and reassures me, and I ask questions and they break it down. So if you are not listened to, there are providers who care. There's ways to escalate if the person on the phone isn't getting you where you need to go. Ask who you need to talk to ahead from there. And just remember, like I said in the beginning, it's up to us to advocate for ourselves. It's up to us to care about our health. We cannot expect a healthcare provider to care more than we care. So if we're not willing to change our eating habits, if we're struggling with metabolic syndrome, or maybe eating things that we're allergic to, or we're diabetic and maybe eating and our blood sugar's all over the place, if we're not willing to change the lifestyle piece of nutrition, how can we expect somebody else to do that work for us, even if it is through prescribing a pill? It's so important for us to be our own advocate. And this is all about, let's use this to empower ourselves. How exciting that we even have the opportunity to do that for ourselves. And I know when we don't feel good, it's hard, but really just getting started in the direction of supporting our health and showing up consistently day after day and getting guidance and support from people who specialize and who you trust and who come recommended on the health journey will carry you a long way, right? We don't need to be perfect. We don't need to know everything. That's impossible. And it's so important for us that we are taking the driving wheel, taking the steering wheel of our life, of our health, in driving the car, driving the ship, right? We don't want to hand over that responsibility to somebody else who has 400 people that they might see, or, every couple of weeks, right? And who's not with us 24/7. So it's a beautiful opportunity for us to say, okay, what's in my control? What support do I need? Let me find a provider who cares, who listens, who can help me navigate this. Let me ask powerful questions. If I don't like the answer, let me get a second opinion. If I'm being mistreated, let me escalate the care. If I'm unwell and can't do this, God, please have somebody in my family or a close friend who can help me. And then there's also different departments within the hospital, within the medical system, who can help with advocacy as well. So I hope this was helpful, and I would love to hear from you. Have you had opportunities in healthcare to advocate for yourself? I can almost guarantee that you have. What did you learn from that? I know in my own experience, sometimes I'm like, the system is challenging, and I always like to bring it back to what's in my control. How can I learn from this? How can I grow from this? What's the opportunity there here? So sometimes the opportunity is to be grateful for my health. Sometimes the opportunity is to have that conversation with my doctor. Sometimes it could be to file a report, and if it's something, major. Sometimes the opportunity is to really get clarity and get in there with your doctor and tell them, like, hey, I'm serious about wanting to be well and wanting to have my health, doc. What can I do about this? This is what I'm thinking. What are my options here? Can you help me here, right? And this is what I want to do, kind of thing. So sometimes it's having those conversations, asking for the support. All right, y'all. Have a great day. Talk to you soon.